Great, thank you everyone for joining. I am Jonny, I'm Head of Programmes and Partnerships at the climate resilience charity Verture here in Scotland, and I am one of the co-leads of the Scotland spoke of the Maximising UK Adaptation to Climate Change Hub. Today is the fourth in a series of lunchtime learning webinars that we've been holding from the MACC Hub, exploring different concepts and ideas related to transformational adaptation across the UK with a number of guest speakers. And today I'm delighted to be joined by three fantastic guest speakers for today's webinar about climate ready healthcare systems, our biggest challenge in the UK. This is one of the biggest topics that we've been exploring through the MACC Hub over recent months, and are going to continue to be doing so throughout our wider work. And I hope today's webinar is going to help us to explore the different types of ways in which climate change is impacting on our abilities to have strong health outcomes across our healthcare systems for people and places across the UK, but also to explore some of the more innovative approaches to responding to climate impacts as well. So I'm going to now turn over to our three wonderful speakers and invite them to introduce themselves. So first of all, Evelin, over to you.
Morning, everyone. I am Evelin Bocanegra, Sustainability Manager. My area focuses adaptation and resilience. I am part of the Climate Change Sustainability Environment team of Energies Scotland Assure, which is part of National Services Scotland. And I work together with NHS boards in increasing the resilience and adaptive capacity of the healthcare assets and services by developing flow risk assessment, climate change risk assessments, guidance tools that can support health boards in increasing the resilience. Thank you.
Wonderful, thank you. And Claire, over to you next.
Yeah, thanks, Jonny. I'm Clare Macintosh, and I work for NHS England for the North West Regional team, leading on the NHS's Greener NHS programme. So we have three integrated care systems within our region, Greater Manchester, Cheshire and Merseyside, and Lancashire and South Cumbria. So I work closely with the three integrated care systems and also with the national team in terms of our delivery of our programme. Thank you.
Fantastic, thank you, Claire. And Neil, over to you.
Hi, good morning, everybody. My name's Neil Cartwright. I'm Claire's colleague from the northeastern Yorkshire region. So everything that Claire's just said, but our four ICS regions are northeastern North Cumbria, Humber and North York, South Yorkshire and West Yorkshire. So between myself and Claire, we cover sort of the northern part of England. And it's fairly safe to say I'm slightly obsessed with climate adaptation.
Fantastic. Thank you, Neil and Evelyn and Claire, for those wonderful introductions. So today we're looking at how the healthcare systems across the UK can respond to the challenges of our changing climate. We've seen in recent times reports, including most recently from the Climate Change Committee, that our NHS services across all parts of the UK are not well prepared for the impacts of climate change, both those we're facing now and particularly those we're likely to be facing in the years ahead as well. There have been some stark warnings about the number of excess deaths that may lead to across the country and our inability to ensure strong public health outcomes as well across all of our society. So I'd like to ask first of all each of you what you see as being some of the biggest challenges to our healthcare system posed by climate change, both those things that you're already seeing and experiencing now and those that you're seeing as significant risks in the near future. So Claire, I'll turn to you first.
That's brilliant. Thanks, Jonny. I think one of the biggest challenges for us in England is that kind of ability to look to the longer term. We're obviously faced within the NHS, we have annual budgets, we have a 4-year government cycle, and it really doesn't help when those things don't help when you're looking at longer term impacts and solutions, and that ability to have that forward projection and ability to look slightly longer term. So I think that's probably one of the key challenges that we have. I think the other challenges that we've had, and through working, as Neil said, we've been working closely with North East and Yorkshire and also NHS Greater Manchester on this agenda. And I think one of the challenges is just really understanding who needs to be involved. There are an awful lot of people across different disciplines that really need to be engaged in this to give us a really valuable outcome. So we've obviously got sustainability leads, but also those working in emergency preparedness, resilience and response. We've got estates and facilities colleagues. And then more broadly, when we start to look at a system level, we've got local authorities, we've got linking in with the environment agencies, we've got the work that's going on in the local resilience forums. So I think there's a challenge both in terms of that longer look, but also in terms of making sure that you're engaging with the right people and the right people are in that space looking at the solutions.
Thanks, Claire. That's really helpful to see that it's not just a challenge of the physical hazards from climate change, but also a challenge of the ability to plan and prepare sufficiently when we have these boundaries of shorter term cycles of having to focus on different areas as well, and not necessarily having that longer term view that is required to respond to those longer term challenges from climate change. Evelyn, I'd like to turn to you and understand from your perspective in Scotland as well, how are you seeing climate change affecting healthcare systems in Scotland, and what are some of the challenges you're seeing on the horizon as well?
Yeah, so climate change is going to touch every part of how we deliver care. Climate change impacts the health of the population, it impacts our assets, our services. There is going to be an increasing number of cases of respiratory, cardiovascular, vector-borne, foodborne diseases, and this is also going to increase the demand of health services, resulting in increasing admissions, longer bed stays, treatment requirements, and also extreme weather events could interrupt communications, IT, water, energy, waste, transport services, and overheating in buildings and also flooding in buildings can disrupt services. So this means that there is going to be also a greater pressure during extreme weather events in our staff welfare. This is going to raise the welfare and also to heat stress and also disruption to travel and increase demand of emergency care. All can make a real impact in our workforce. And again, because they are going to reach high level of stress, their good performance is going to decrease at the same time. And therefore, this compromises the provision of quality health services. So we can see here, like there is a pattern, like a vicious circle that is going to affect the health service in general. Also, our healthcare state is aging. And many of our hospitals and assets were built long before we were even thinking about mitigation and adaptation to climate change. So making those buildings resilient to extreme weather events or more sustainable in long term is a big piece of work, and it takes both time and significant investment. And talking about this is like funding and capacity are big challenges because NHS is already under pressure within rising demand and workforce shortages. So sustainable projects often cannot compete with this kind of immediate operational priorities. Even if we talk about mitigation and adaptation, adaptation projects are often prioritized over the adaptation ones, because yeah, it is like that, and we have seen that in the recent years. Now adaptation is starting to gain more attention. However, we need to do more about that. And then there is also another issue with the data that we have. It is not enough. We need to keep collecting data, evidence, gathering information. We have good national strategies, but then converting this into local board level, site level strategies or plans is also going to be a huge piece of work, and it's going to take some time. And also we have the global logistics, because climate disruptions can easily impact the delivery of medicine, food, equipment. Then building in more local and resilient procurement is also going to be essential for climate change. So yes, I think this is the biggest challenges that we are going to see, not only in Scotland, in the UK, and worldwide.
Thank you so much. There's quite a wide range of challenges there, and I think what was really evident from what you were saying there is the challenges are both specific to climate change, as well as the ways in which climate change is exacerbating other challenges that we're facing in relation to the estates, the wider infrastructure, and health and well-being of staff as well. And Neil, I'd like to turn to you and ask as well, from your perspective, what you're seeing across the teams that you work with across your region. How is climate change impacting on your ability to deliver against the health outcomes that you're working towards, and ensuring that we have safe populations, that we have healthy populations, and also that the staff working across the NHS teams are safe and their well-being is being prioritised as well? How is climate change affecting those priorities?
I think it's fair to say, in terms of what Clare and Evelin have just said there, there's key elements for me. One of them is around, and I think Clare mentioned it, which is sort of from those individuals who are sustainability practitioners, who work in systems, who work at trusts, it's that whose job is it around climate adaptation. We issued, and the importance of it as well, the importance given to climate adaptation in terms of that time. So we earlier this year, so the NHS in England, we ask for trusts and systems to create green plans, and green plans are, it's like eating the elephant. So the NHS is broken down into a number of facets. Only one of those facets is around climate adaptation, and I think for me that it buries the adaptation part of the work amidst this whole raft of issues around emissions reduction. So that's challenging in and of itself. The other thing I think is this whose job is it anyway thing. So I'm an emergency planner. I have been an emergency planner by background. So is thinking about climate adaptation, is that the job of the sustainability lead? Is it the job of the EPRR team? Is it an estates and facilities role? Where does it sit in terms of that Venn diagram of responsibilities as to who the key individuals or teams are that are leading this work going forward? And I think in not having that, I think it's difficult to understand then, okay, so it's your job. Because if you within a trust, you would have something called an AEO, which is an accountable emergency officer. So this is a board level individual who is named with a responsibility for that organisation's emergency preparedness. That's the accountable emergency officer. We also have a sustainability senior responsible officer on the board as well. What we don't have there is an individual who is at that very, very senior level of that governance hierarchy, whose job is very clearly about climate adaptation. The other bit I think is worth reiterating as well. It's what Evelyn touched upon there, is the challenges of our infrastructure, our aging buildings. So we already know that the NHS in England has a huge backlog maintenance challenge in the billions in terms of backlog maintenance. So jockeying for position amidst a challenging, let's say crumbling now, but amidst an estate that is in and of itself quite old and quite challenged, is a difficult thing to sell. And then I suppose my last point, Jonny, will be around the stuff that we're building right now, the community diagnostic centres that are appearing across England, the facilities that we're building. Are we fully baking into those buildings, pun intended, are we fully baking into those buildings, thinking around increasing flood risk, overheating, and those challenges that we're going to face going forwards? Because I really don't want to be that person who has to explain in 10 years' time, why can't we use that building because it's far too hot, because we've glazed the south side of it, when we really should have been factoring that into conversations now for stuff that's going to be used in a decade or 2 decades time. And I'm sorry, last point is mental health. Mental health, the challenges that are faced by, we need to remember that our staff are our community, and our community are our staff as well. There isn't a line between them. And I think for colleagues that work in areas that are seeing flooding that takes place on a now more regular basis, there are mental health impacts to those colleagues that are living in those spaces, living in those buildings that are becoming less easy to insure, and almost that impending challenge and anxiety around what it is going forward in terms of if it chucks it down this winter and we suddenly get a month's worth of rain in 3 hours, is my house going to be underwater again as well? But I think there's something key here about mental health in terms of resilience as well, Jonny.
Thank you, Neil. And I think that point as well about how there was two really piecing points that you mentioned there that others hadn't picked up on. One around the leadership as well. Do we have sufficient leadership on responding to our changing climate across different areas of our healthcare systems? Is this being sufficiently prioritised alongside a whole range of other priorities that are having to be dealt with and emergency situations we're having to respond to across our healthcare system? Or do we have that leadership to have that longer term view beyond those cycles that Claire highlighted that are slightly shorter term, to say we also need to be thinking about how we prepare and act now to respond to the changing conditions in the years ahead? And also that point you've made there as well about the impacts of mental health on people right across society, whether that is patients being treated, whether that's suppliers that we're working with, or whether that is staff within different healthcare settings as well. And Claire, I'd like to follow up on that point with you, if that's okay, around the impacts of mental health from climate change. Are you starting to see the impacts of climate change affecting those that you're working with across the teams in the Northwest? Are you starting to see any changes in the kind of conditions that people are having to be supported with when they're coming for support across the region as well? And how might we best respond to that challenge through our healthcare system as well?
Yeah, I think that's a great question, Jonny. But I think one of the things that we are sadly lacking on is sort of supporting data, really, to fully understand the picture and what is driving different things. So I know the UK Health Security Agency have done a lot of work more recently looking at deaths associated with heat. But I think in terms of those wider connections and understanding fully the picture of, you know, what are those true mental health challenges that are being exacerbated by climate change issues, it's difficult really to fully understand sort of the picture. I know we've seen sort of examples through people that have had their houses flooded, and then obviously that hasn't been an isolated incident, which years ago it would have been, you know, where it's been happening multiple times, and people have had to cope with that devastation, not only the impacts to their house, but then probably the impacts financially, because insurance isn't then available to them because their house is in a flood risk area, you know, all those kind of ongoing challenges. So I think we probably need that supporting data to really truly understand the picture. But I guess it would be an assumption to say sort of what, you know, how has it increased because of climate change? I don't know whether Neil's got anything further that he can add to that.
I think I'd say one of the challenges that we face is it's almost not serious enough. And so in the NHS, we're really good at emergencies. We're just really good at responding to short-term issues, and that happens, and then that's gone, and then we move on to the next thing. And so we spend a lot of time when we talk about climate adaptation. It's actually, I think, there is something here about picking the time that we have that conversation, because it's very easy to talk about challenges related to heat waves and what those challenges are to staff who are working within a hospital setting or community staff that are out in their cars all day, it's easy to have that conversation when it's boiling and when you're sitting there sweating. It's easy to have the conversation about flood risk or emerging flood risk when you're on the train and you're, as I do, and I'm going across, I don't know, parts of the Trent or parts of South Humberside where I'm looking out at farmers' fields that look like paddy fields. There is something about how do we maintain the importance of this conversation when we have very, very short memories. And then going back to something I think Claire said at the start of this as well, which is sort of everything's urgent within the healthcare system, and everything's politically driven. So these are the political imperatives. This is what's really, really urgent. We need to respond to this, and all hands to the pumps in responding to this. Waiting lists, whatever that. And these things are not unimportant. They're hugely important. But at the same time, when we're responding to those things over here, it sort of pushes out that some of that more that could be seen as more important long-term thinking and long-term planning around the ramifications and implications of climate impacts on colleagues and members of our community. And I suppose the other thing is this stuff's not equal, is it? So I think there's a correlation between deprivation and vulnerability in the context of climate adaptation as well. So again, those people who are, I think, least able to, it's the same people, those people who are least able to participate in what we would call the transition, for whatever reason, are also those people who are least able to cope in terms of issues relating to overheating and heat waves and that flood risk and some of those supply chain issues that then knock on to costs in supermarkets and then knock on to issues around healthy eating and things like that. So I think one of the challenges that we've got, Jonny, for you to sort out through the MACC Hub is the complexity. It's the complexity and the systems thinking necessary in order to address this. Is that this is not a very simple pull this lever here, that will sort everything out. It's the interrelated. I think there is something to do with that. The complexity of the situation means that it becomes something that is too complicated, and therefore we'll do something about it the day after tomorrow because this stuff over here is easier to understand. So I sorry for rambling a bit there, but I think some of the challenges there that link back to what Claire was saying is it's possible to respond to something if you've got accurate and up-to-date data on that thing, whatever that thing is. But we know, I mean, the Climate Change Committee report said that within health, we have effective monitoring of overheating. I think I would question that. I think our monitoring of overheating is almost based on submitting DATIX reports to say it's really, really hot on this ward. And therefore we take that as being chapter and verse in terms of the overheating incidents within our organization, as opposed to being in the same way that we would use an electric meter to measure how many kilowatt hours we've been using. We don't have those electronic, not all, well, some do, but we don't have that universal monitoring of temperature to be able to say this is the picture and this is where the challenges are and this is where we need to direct our attention.
Thank you, Neil. And Evelyn, I'd like to turn to you. So Neil's highlighted there one of the challenges being around data and really kind of understanding the risks posed in different areas as well. I was wondering whether you could talk a little bit about some of the work that you've been involved in Scotland to map and identify how climate change is affecting and is likely to affect different parts of the NHS estates in Scotland as well.
Yeah, collecting data is not easy for us, of course, because we have hundreds, thousands of assets, and we started work with our climate mapping tool, which uses Scottish Environment Protection Agency data, UKCP 18 data. We also have the GIS map of our assets and our boundaries. So we map this against the SIPA maps to see which sites are potential risk of flooding. also have, for example, in this map, we have the National Cycling Network, local cycling network, to see if it could be disruption to the transport of patients and staff. And yes, this is a tool that boards can use to see if there is a potential risk on the transport system for them, and also how can this impact the healthcare assets. However, this is just high level because this is a visual tool. We need to undertake also floor risk assessments, go inside, do site visits, run a deep analysis to see if it is actually gonna be an issue for the healthcare assets. But this is, again, this is just a starting point. We need to start developing vulnerability assessments maybe per site related to flooding, overheating. For other sites, there have been issues with overheating in some wards. So collecting this data with specific devices for maybe developing thermal assessments or overheating assessments in sites is also another step that we need to follow. But unfortunately, not all boards are capable of doing this because even of time constraints, they don't have the devices to do this. There is no people available to undertake this kind of assessments. We need a specialist. So as I was saying also at the beginning, and what I completely agree with Clare in Nailed, this collection of data is key at the same time, because with this we can actually start deciding what are the next steps for adapting to climate change and make this more tangible in a way of saying, because right now it's like, yes, we are planning, we are thinking, okay, we can do this to increase our resilience, but there is not concrete action right now. So boards are wondering, okay, I have a high level adaptation plan where I say, okay, I have to develop business continuity plans. I have to work with local authorities. This is good, but at the same time, it's still not enough because we are not addressing the actual issues yet because we lack this kind of data. So yes, we have been doing this kind of work. I am going to undertake some flood risk assessment for 6 prioritized sites because we undertook flood risk review of 66 acute sites in NHS Scotland. So now what we are going to do is that for the prioritized sites, we are going to undertake flood risk assessments. We're going to do site visits and go with a specialist to analyze the risk of flooding in these sites. I know that I am going to find some interesting information that is going to feed into potential maybe a report for adaptation solutions. However, I am still to see this. So these are just the first steps that we are taking here in Scotland. And but yeah, I completely agree with Neil and Claire. We need to do more about this.
Thank you, Evelyn. And you've highlighted there as well some of the different sort of support that's been available to some of the NHS boards across Scotland as well. And we know that most NHS boards now have undertaken a full climate change risk assessment over the last couple of years as well, and you're starting to use some of that data to inform that. Claire, I wanted to turn to you and ask about in England, what are the kind of tools and resources and support that is available to different teams across the NHS and the wider healthcare system more broadly to support them to help understand how climate change might be impacting on their areas of service delivery and what they can do to respond to that as well?
Thanks, Jonny. I think firstly, the thing that I would highlight is that the government's recently produced the 10-year plan, an NHS fit for the future. And as part of that, it does highlight that all NHS bodies will be expected to decarbonise, reduce environmental impact and increase resilience to climate risks in line with the climate duties that are set out within the Health and Care Act. So that gives us quite a strong sort of initial starting point and a hook, I guess, to make sure that this work is seen front and central. And we've also been working very closely with North Eastern Yorkshire and again NHS Greater Manchester and supported by Verture and Sustainability West Midlands, and we did some work working across the northern region looking at working with some of the trusts and ICBs within that locality, and we adapted the Adaptation Scotland Climate Adaptation Capability Framework to a sort of NHS version, or an NHS context. So that has really given us a strong kind of roadmap for the NHS organisations to both use as a kind of self-assessment opportunity, but also more importantly to identify sort of further opportunities that they can start to look at. So that's kind of split into 4 key areas. I'm sure people will be familiar with the Adaptation Scotland version, but sort of looking at understanding the challenge in the first instance, the organisational culture and resources, planning and implementation, and working together. And it sort of sets out different levels. So if you're starting or beginning the journey, if you've perhaps already started to, you're perhaps along the journey in terms of understanding the challenge, it gives different stages. So you can go to intermediate, advanced, and then on to mature, and develop that understanding and program within your organisation to work towards climate adaptation. So that's been really brilliant in terms of adapting, and it also went through our approvals process nationally, so it's now been adapted by us nationally within NHS England to progress our climate adaptation journey. I think supporting that, there was also some training, which again is key for staff and colleagues to understand sort of understand the challenges and how they can address those. So we developed again with Verture and Sustainability West Midlands two training outcomes. So one was a slightly longer training course, which was 6 hours in length, and that was called Becoming Climate Resilient, and that was geared more to our kind of operational staff, so our sustainability leads, our estates colleagues, our EPRR colleagues who were working more operationally on these issues. And then we also did a shortened 1-hour version for senior managers and leaders within the NHS. So that was called Empowering Leaders for Climate Adaptation in Healthcare. I think we've touched on earlier when we were talking through some of the challenges that I think Neil mentioned around leadership, and that's really key, is getting those senior managers and leaders to be championing this as a challenge moving forwards, and then also our wider workforce in the opportunity that they have in terms of some of the day-to-day activities they're undertaking, and looking at how climate changes will be impacting some of that delivery in the sort of medium to longer term, and how they might start to address that and future-proof that. There is also nationally, there's a climate change risk assessment tool again, which supports organisations. I think Evelyn touched on the tool that they're using within Scotland. This has been developed by our national Greener NHS team, and it focuses predominantly around buildings, but looking at some of the challenges associated with our changing climate, and taking people through a kind of methodical sort of route for risk assessing some of those challenges. So yeah, those are just some of the tools, and we can certainly drop some of the links in the chat to those. Again, Neil, I'm not sure whether you want to add anything to that.
Not sure there's much more to add, Claire. Thank you. No, yeah, we basically sat back a couple of years ago and recognise the fact that we are asking NHS organisations to produce an adaptation plan, create an adaptation plan. Then the question is, well, what's one of those then, and how do we go about it? And there wasn't really any methodology for how to approach that challenge. So essentially we looked over the border into Scotland and saw how far ahead of us, frankly, the Adaptation Scotland programme was, and as Claire's mentioned, the work that had been undertaken by colleagues north of the border, and tested in anger with a number of organisations, a number of public sector bodies in terms of the adaptation capability framework, and sought their support to be able to translate that into language, but also into a context that would be able to be picked up and to be used by NHS organisations, in essence, to create the route map. And as Claire's just identified, the sort of understanding the challenge, organisational culture and resources, planning and implementation, and working together are the individual facets of that plan. The beauty of that is that you're able to measure your own progress against that. So I think for us, having the NHS Climate Adaptation Framework formally adopted as national NHS England guidance for NHS organisations in England, I couldn't get the grin off my face when that happened. So that's incredibly gratifying to have that work adopted across the NHS in England. But at the same time, for me, it's like, so where do we take this from here? And I think for us, it's how do we utilise the adaptation framework to be able to start to see where we are around maturity within an organisation. And to do that is to have that honest appraisal against the standard to see whether you are starting or whether you are at that level of maturity where you would consider yourself to be mature as an organisation. Again, it gives us a tool to be able to measure maturity against those individual facets, and it's within that part around understanding the challenge that the climate change risk assessment template that our colleagues in the national Greener NHS team have produced, the climate change risk assessment template, very much focused around buildings and operations, but an incredible piece of work as well in terms of that journey. The challenge for us sometimes, I think, is that some of this conversation can come over as very negative and quite disempowering. I think in terms of NHS, our work in the climate space is outstanding. It's leading the world. It's other parts of the world are picking up the challenge and catching up with us. And I think the work that we're doing around climate adaptation is just a couple of steps behind that as well. So I think there's reason to be really positive about this. And if I go back to time when I was responsible for emergency planning in my previous organisation, emergency planners on this call will recognise something called the core standards. It'll make them twitch a bit when they hear the core standards. So it's an annual self-appraisal of an organisation's emergency preparedness that's undertaken. Back in 2019, we had something called a deep dive within the core standards that actually was asking about climate adaptation. So we have been thinking about this for a number of years, but for me, it's how do we create this sort of IKEA flat pack approach to do this, and this as how an organisation will approach that adaptation maturity, and then what is and our work, I think, is how do we then socialise that work going forward so it becomes more and more useful, that we can evaluate it and we can seek to improve it going forward. So yeah, thank you.
Thank you, Claire and Neil. It's great to hear about the wide range of work and support that's been taking place across England, and that some of that sort of shared learning as well between what's been happening in Scotland across the public sector and how that's then been applied to support NHS teams across England as well. Evelyn, I was wondering whether you also wanted to kind of highlight some of the ways in which teams across Scotland are being supported to assess the kind of climate change impact that they're facing and then plan about how they can respond to those in the future as well.
Yep. So back in 2018, we developed a climate change risk assessment and adaptation planning tool to support boards in this analysis and planning for the future. So boards have worked on that, and now all boards have developed climate change risk assessment, the 22 boards in Scotland, and 18 boards have developed health national adaptation plans with adaptation actions that answer to these climate risks that were identified in the climate change risk assessments. And as a result, we also produce a summary report, which I have shared the link in the chat, which brings together all the results of these risk assessments and adaptation plans across all the health boards. And so that gives us a national picture, and it helps us identify common risks, where we are making progress and where we still have gaps to close. And on the infrastructure side, we also have got the Sustainable Design and Construction Guide, which I also share in the chat, the link, that provides clear guidance from making new or refurbished NHS building, both low carbon and climate resilient from the start. So this is the kind of tool that we are providing to the tool and guidance at the same time for the boards. With this, because keeping that in mind, we from the report, we realized that flooding and overheating, as well known, were the main climate risk here in Scotland. So that's why we enhance our climate mapping tool. Unfortunately, I cannot share the link now because it's going under infrastructural changes. And also we are undertaking the flood risk assessment that I mentioned before. And now we are also working in developing an adaptation resource hub, which is designed to guide NHS Scotland boards through the journey of preparing for, planning, and responding to health challenges of climate change. And it brings together these and other tools, including, for example, the Adaptation Scotland ones, the World Health Organization guidance and tools, other case studies, and that are going to support decision-making at every stage of the adaptation process. And also we are developing, and we just started on the work with the work of the adaptation guidance for NHS Scotland boards, which purpose is to provide boards with a structured, evidence-informed framework to assess climate risk, plan for adaptation, implement resilience measures, communicate the case for adaptation, and also evaluate progress over time. So there is still work going on. We have some tools. We are still working on developing new tools. There is also, as part of our sustainability action program, there are also, for example, green space and biodiversity groups that work in topics related to adaptation to climate change. Also, transport and active travel groups that work in topics related to adaptation to climate change. So it's a work that different teams are undertaking, and we are all working in collaboration for the same goal. So this is what is happening in Scotland at the moment. I think you're muted, Jonny.
Thank you. Yeah, it's wonderful to hear about what's happening there in Scotland, and also to hear about some of those new resources coming on board as well, for like the support hub that brings together all the different support, guidance and information, and case studies as well, to help people understand how they can take forward some of that action. Evelin, staying with you, you were mentioning there at the end as well about connections with other groups. You talked about so connections with transport teams and connections across with other community groups as well. So thinking about how we take forward action to ensure that we can have climate ready healthcare systems in Scotland and across the rest of the UK, what do we need to do differently in the months and years ahead to best respond to the challenges we're facing, and how can we do that in collaboration with others?
Yeah, so I think we need to put equity at the center of climate and health planning. That means understanding which groups are most at risk: older people with chronic illnesses, for example, those in lower income and rural communities, and making sure our adaptation work actively reduces those inequalities and not widens them. So we also need to design services that are flexible and community-based. And during heat waves or flooding, for instance, access to local healthcare can make all the difference. So strengthening community resilience through outreach programs and social care networks is also really important here. And we will also need to work, and this is obvious, but at the same time it's really important, work across sectors much more closely, because with health, for example, and with housing, with transport, agriculture, and local government. Good health in a changing climate depends on things like warm, energy efficient homes, and also clean air and safe spaces for active travel. These are health interventions too that don't sit inside NHS, but are really important for the health of the population. Another big change we might want to attend is climate literacy across the workforce. Everyone in healthcare, from clinicians to decision makers, all of them need to understand how climate impacts their patients and services, and how their decisions can support resilience and sustainability. So this is also very important. And also embedding climate change adaptation into every level of decision making, from national policy and health board strategies right down to local services planning and clinical practices. Also very important, because usually adaptation is considered as something additional but not as part of, and we need to start thinking that adaptation should be part of every aspect of every strategy in healthcare system. So we need to listen to our communities, our staff, because they know what makes them vulnerable and they know what they need. The problem is that they don't know how climate change is going to impact them. So once they are aware of this, I think they can also be an excellent resource for us to actually take adaptation forward and make real progress.
Thank you so much. And Neil, coming to you, we've heard there as well that point Evelin just made about adaptation often being seen as something additional and not really being integrated into the wider decision making and planning and structures of how things are taken forward and prioritized. From your perspective, what do we need to do differently over the coming months and years to ensure that that changes and that it does become a priority and the urgency is recognised and it is mainstreamed across all areas of decision making and planning?
Yeah, thanks for that. I think our communication is a barrier in terms of, so the language that we use in sustainability is inherently a barrier to progress. I'm not sure people understand adaptation. I'm not sure people understand when we talk about tons of CO2. I'm not sure people understand what net zero means. So I think there's something that we need to think carefully about in terms of how we undertake to talk about climate risk going forward and those impacts of a changing climate. The other thing I think that we have within the health system is, and it's a bit of a superpower really, I'll just post it in the chat. The Ipsos do a survey, it's called the Veracity Index, and this is about who are the most trusted professions. And if you look at the Veracity Index, we have doctors, engineers, nurses, academics at the top. So working with people like yourself, Jonny, and working with the universities in partnership with healthcare, I think you are picking up some of the most trusted voices in our country, in our communities. Ironically, at the bottom of that list is politicians, journalists, and government ministers. So I think that the open door is to work with our clinical colleagues and to work with academia in order to be able to talk about the health impacts of climate change or what it is that we need to be thinking about around modifications. The second thing I'd say as well is a lot of our language is about how horrifying it's going to be. It's a very negative framing around climate change, and of course it's negative, but in terms of that framing, I think that can sometimes promote paralysis, and it's overwhelming and it's too much. So I think we do need to, I think action drives behaviour. So I think demonstrable action by the healthcare system in and of itself will change behaviour and will move and create action within wider parts of society as well. And then I suppose the last thing I'd say on that as well is, and it's a comment that's made in the chat and I think in the Q&A as well, is around so we've looked at the climate change adaptation framework. We understand our level of maturity. We've started to work together. We've done our climate change risk assessment. We know where our challenges are. So what are we going to do then? So where is the platform that shows us the best practice if this is our problem, what is the best solution? And there's something to be said there for looking internationally at examples and lessons that can be learnt from around the world, from places that are already experiencing and meeting the challenge that we're going to be facing in the next few years as well. So I've said a lot there. So I think there's something about the use of language and communication. There's something about the carriers of those messages. And there's something for me really powerful about don't wait till everything's perfect. And there's a question in there about complexity. I think start. I think if we wait for something to be perfect, we'll never get off the starting blocks. So having these conversations, having these messy, imperfect conversations with colleagues within organizations and externally as well, they may be a little bit clumsy to start off with, but at least we're starting those conversations. So it's not to be afraid of the messiness and just start. Thanks, Jonny.
Thanks, Neil. I think there's some, that point there as well of not having to wait for things to be perfect, but recognizing that virtually any action we start to take now is going to help us move forward and be able to respond to some of these challenges is really important. And that while having the data to be able to back up some of to make the case in many cases for change, actually we recognize that there is a risk and that risk is going to increase over time, then starting to take action now is going to help us to progress things forward. We've got a few questions coming in through the Q&A, but Claire, I'm just going to turn to you finally and ask, from your perspective, building on everything that Evelyn and Neil have said, what more can we do in the coming months and years ahead to ensure that we can kind of accelerate action and move also from the sort of planning phase around adaptation action into seeing change really happening on the ground?
Yeah, thanks, Jonny. I think Evelyn and Neil have really kind of summarised nicely the sort of key things, but I guess I would just add the opportunity. So within NHS England, that we're going through a huge transformation programme currently, and we're moving with our integrated care boards from having 42 down to 26, and there being a much stronger focus placed on the strategic commissioning side. We're waiting imminently for strategic commissioning guidance to be issued. I think that's coming out towards the end of October. But I think, as Neil had mentioned, that there is that opportunity, as well as looking at the environmental impacts of the services that we're delivering. It's also looking at those adaptation changes that need to happen to future-proof the services coming through. So I would very much like to see that through that strategic commissioning, that as well as looking at there is a public policy procurement notice, that touches on social value, so the social, economic and environmental impacts of the particular healthcare service that's being commissioned. I would very much like to see climate adaptation sitting there, looking at some of the challenges that we face and how we're addressing those to future-proof the healthcare services, as well as looking at some of the challenges that might be, some of those changes that might be happening to the types of healthcare services that we might have to deliver in the future as well. We know sort of links between sort of weather, the heat particularly, and CVD, impacts with air pollution, sort of the impacts of that increasing due to things like wildfires and droughts, and the impact that has on respiratory conditions in particular. So I think it's making those links and educating and supporting our kind of commissioners in that journey, so that things can be embedded right from the very start. So I think in addition to all the other points that Evelyn and Neil had raised, I would just add that one.
Wonderful. Thank you, Claire. Thank you, Evelyn and Neil. That's been a wonderful discussion, exploring some of the impacts of climate change across our healthcare system, what we're exploring to be able to support teams and organisations to respond to that in places across the UK, and then also how we can move forward differently to ensure that we can accelerate action as well. We've got a few questions coming in on the Q&A function just for our last couple of minutes. So I'm going to probably just ask one of you to respond to those each, because we don't have a huge amount of time. So Evelin, I'll maybe ask this one to you. So now that the question from Jamie Tony says that now that we're taking the adaptation, oh sorry, this one's more for Clare and Neil actually. Now that you're taking the adaptation capacity framework forward, where are the gaps to taking a more systems thinking or systems change approach? So sorry, this is more for Clare or Neil, if either of you would like to respond to that.
I think in terms of the NHS climate adaptation framework, my invitation is pick it up and use it and kick it to pieces and give us feedback. And you're not going to upset or bruise our egos in terms of any of that feedback. But it's there as a route map. It's there as a tool to be used. So I suppose my invitation is pick it up and use it. If you pick up the copy that's on the We Adapt platform, it's all colourful, and there's guidance that's associated with it as well. The one that's on our NHS England platform for accessibility reasons, quite rightly, has made it more accessible, but it's also made it less attractive. So jump on the We Adapt platform, pick up the adaptation framework, and kick the tires on it, and recognise that we are where you are. We're starting this, so let's have that feedback and let's iterate it and let's improve it as we take it forward. The other thing I'd say as well, Jonny, just really quickly, is about language. Is when I'm talking about climate, whether it's emissions reduction or whether it's climate adaptation, I basically talk to my dad. My dad was a coal miner who was an extremely intelligent person, but he wasn't formally educated. And it's having those conversations in a way that meets someone at their level to make sense of it. And one of the comments there around language as a barrier, it's exactly that. I think it's our responsibility to be conscious of the language that we're using to make sure that what we're talking about lands.
Thank you, Neil. And on that point, Evelin, I'll ask you this final question from the audience. So Lynn has asked, she said, climate is often seen as elitist. How do we engage better with our communities and effectively address things like disinformation as well?
Yes, this is an issue that we all have even internally. We need to clarify and communicate the urgency with the same language as Neil was saying. So we need to frame adaptation as a priority and understand that health care is not just infrastructure and services, it goes beyond. And this is whatever we do is for the health of the population, it's for the community. So this needs to be understood by everybody, as I mentioned before, from healthcare professionals to planners to our leaders. So we are in a position where we need to start work right now. We have started work, but we need to do more. We need to actively engage with these adaptation strategies and also position adaptation within existing policy frameworks, resilience planning and sustainability targets, for example, or empower champions as well across different departments and NHS boards. So we need to keep communicating that adaptation needs to be done now and that the impacts of climate change are imminent and that we need to keep moving forward. So yeah, that's what I can say about that question. Very difficult one.
It is. It's a very challenging one, and yeah, it goes beyond the role, I guess, of NHS, but it's about how we maybe work together with others to ensure that that message is clear and understood. Well, thank you to Evelin, Clare and Neil for such a wonderful discussion today. My colleague Jen is going to be posting in the chat in a moment a link to a survey. We'd really appreciate it if you could please complete the survey just to give us some feedback about today's webinar, and so we can best plan future webinars as well. I'd also encourage everyone to please go onto the MACC Hub website. That's a Maximising UK Adaptation to Climate Change Hub website, and to register for things like the newsletter so you can stay in touch with everything that we're doing across the hub. I just want to say one final thank you to our three wonderful speakers today. It's been so exciting to explore all of these different topics with you, and I'm really excited to see the kind of change that we're going to see across Scotland, England and the rest of the UK as well, to support teams to take more effective adaptation action and support different communities and groups and places right across the UK as well. Thank you all, and look forward to seeing many of you online or in person very soon.